Hello and welcome to Oxwide for Friday the 12th of February. This week we've had the news through that we've now vaccinated around half of our staff against COVID-19. The teams at Queen Mary's Sidcup have been working some very long hours and putting in a shift to make sure that as many of us as possible are protected. And we've now got to the stage where more than 3,000 people are vaccinated through that QMS unit. Some of our partners as well, people working for ISS Ridings, social care staff and other partner organisations on the site have also been through there. And the great news is that means we're getting more protection out to more people week by week. Do keep an eye on the Ox because we are putting on additional clinics now, a couple of days a week rather than every day, to make sure that you can get booked in and get that protection. And that'll be followed up with your second vaccination in due course. And for everything you're reading in the papers about this, it is worth remembering that this vaccination, the AstraZeneca one, has been proven to have very good results in terms of preventing serious illness from COVID, as well as reducing the transmission of the disease, we hope, and preventing people from getting sick in the first place in a number of cases. So there's some really good positives for this. I've had my first jab, got my second jab booked in, and I would urge all of you to do the same. If you're concerned about the vaccination for any one of a number of reasons, please do have a look on the Ox. There's a lot of information on there. There's films with colleagues from all different parts of the trusts talking about their experiences of it as well. And of course, you can always make sure you take time to talk to colleagues and friends who you work with to find out more about the vaccination and why it's a good idea. In the longer term, it's going to become an important part of our seasonal defence against coronavirus, I think, along with the flu. And there's also all kinds of implications for things like travel, etc. So I think, if you've got concerns about it, it's good that you get those addressed early on, because protecting yourself, your family and your patients is a really important thing we can all do for ourselves and for each other. So in today's show, we've got a couple of things coming up. First of all, I'm going to be speaking to a few of our colleagues from ICT about the new Office 365 rollout. We're then going to hear from our CAMHS team, that's Child and Adolescent Mental Health Services, about some of their recent work. Last week was Children's Mental Health Week, and we've been hearing a lot about the impact of the pandemic on children's mental health. So it'll be good to hear a bit from them about what's going on. I'll then be talking a bit about microaggressions and what that means for some of our colleagues here at Oxley. So if you don't know what microaggressions are, do make sure you stay through and have a listen to that. And at the end, I'll be back to say cheerio after we've heard from everyone who's with us today. So first of all, I'm going to speak to a couple of our ICT colleagues about Office 365. I'm joined now by Nik and Lee from our ICT team. You're here, gents, to talk about our Office 365 rollout. So firstly, what is Office 365?
Thank you, Matthew. Office 365 is a SaaS, which is software as a service based platform that supports an integrated experience of applications and services. One of the most widely used software suites in the workplace, Office 365 brings together applications that allow users to work collaboratively with increased engagement and be more productive. It is well known that improving the Office 365 suite improves collaboration and communications can increase productivity by 20%. Using Office 365 saves each user around 30 minutes per day.
Right, so this sounds like something that's well worth doing. What sort of features will people notice, Nik?
Yeah, so initially we're talking about mobility to start with. So this is the ability to be able to view, edit Office documents with Office mobile apps. So that will be able to be used in your browser, on our new Windows desktops, and obviously our iPhone and iPad devices. That obviously leads into Office for Web, which I've just covered, which is obviously Word, OneNote, PowerPoint, Excel, which again can be then used from the browser directly or from the new software we're going to install onto all the desktops. The next part obviously will be a hub for teamwork. So as you're all aware with Teams, we can connect with Teams using Microsoft Teams in Office 365, chat, contact people, and basically just kind of have that lived in together experience with us all. And obviously aside of that will be schedules, assigning tasks and connecting to other apps as and when they become available. And I suppose the biggest side effect of Teams is obviously online meetings. We've all been able to host online meetings with audio, video chats, web conferencing, broadcasting as we're doing these days. And obviously this can reach up to a much greater audience than before, when we were simply either in meeting rooms or just chatting between our teams.
And I think these days much more of us are using things like the Teams files facilities to share documents and chat, and to be able to then seamlessly move between that, Outlook, PowerPoint. You know, it's definitely a much better experience. I'm saying that as someone who's been sort of testing this out. So how did it come about that we're doing this rollout this year? Because we've been talking about it for a while now, haven't we?
We have, yeah.
Yeah, this has come around in sort of two parts, really. The first being the requirement of NHS Digital to migrate from our old NHS Mail locally hosted environment to a cloud-based Microsoft Office 365 platform in line with their IT roadmap. The second is that the Trust needs to upgrade our local Office 2010 environment, as this product is no longer supported by Microsoft and potentially proposes a cybersecurity risk.
Okay, so it's sensible enough for us to get on with it. And when's this going to be? I mean, I've been using it as part of the testing, which has been really good, the 365 mail. Have we had any issues along the way?
Unfortunately, yes. NHSD had to migrate 1.4 million mail accounts, and as we all experienced, this manifested itself into a sort of a slow migration and a poor performance on accessing individual mailboxes, especially at the beginning, due to us being on the old Internet Explorer 11.
Yeah.
So as part of that, or in response to that, IT deployed the new Edge, which has now increased the actual performance and made things a lot better.
I mean, I really noticed that anytime I accidentally open Internet Explorer, it's like stepping back in time, isn't it? But with Edge, it's a much slicker experience all around. So it's been good. When's this going to be available to all of our staff?
So at the moment, we've just completed our initial testing stage, which I'd like to thank you for being part of, where we've obviously had a number of staff using this, which has been successful. And we're just about to move to deployment over the next couple of weeks. So obviously, if I can ask staff to just make sure they keep an eye out for any global emails we send out. We're typically going to change the way we do deployment. In the past, we would normally do a big push to all Trust devices, but because we know staff are now working remotely using the VPN, or dipping in and out of work if they're on the go, being mobile staff, we're going to actually allow staff the opportunity to install this at their own leisure.
Right.
So that will be covered in the email, where staff can have an icon on their desktop. They'll be able to install it. Obviously, understand that there'll be a 30-minute period where it installs, and then they'll be able to use the new system straight away.
Perfect. And looking forward to this. And I've noticed I've got Outlook installed on my laptop. I think certainly talking to Sue and some of the team, getting proper full Outlook's going to be a real big game changer for us. When's that going to be available?
So as Nick's just said in the actual rollout, what we're looking to do is push Outlook as part of the client that goes out on any of the Trust laptops. And the reason for going with the Trust laptops is mostly a Trust laptop is allocated to a single person.
Yeah.
And that laptop is also encrypted. And due to only having sort of one person allocated to it, the files that it's going to store locally are safe and secure, and are not going to take up the whole of the actual hard drive.
Right.
And that's part of the reason for not going onto desktops is that generally a desktop is a multi-user device, and only has a certain capacity in regards to storage. Therefore, if multiple people are doing it and it's downloading different accounts, that could cause an issue in the future.
You end up with loads of massive backup files, don't you? DAT files and stuff sitting around on the hard drive that you don't need to. All right. Understood, gents. Well, look, this is going to be a really good development in terms of improving people's flexibility. I mean, ICT in the last year, you've been sort of real heroes behind the scenes in helping us deal with the pandemic. So thanks, gents, to you and your team for all the tremendously hard work you've done and that you continue to do, because it's enabled us to come through this pandemic in the way that we have and keep providing care and keep in touch with each other. So it's really well appreciated. And next up, we're going to hear from some of our colleagues in child and adolescent mental health services. So we're going to have a short film now. Thanks again, though, to Lee and to Nick.
Thank you.
Hello there, I'm Teresa from the CAMHS team, and I'm here today with Dominic Leigh, who's our CAMHS service manager, and Rebecca Wheatcroft, who's the clinical lead for CAMHS. And we're going to be talking a little bit about how CAMHS are working during the lockdown and how they've seen a little bit of an increase in demand. 1st of February marks the start of Children's Mental Health Week, which was an opportunity to shine a spotlight on children and young people's mental health. If I can go over to you first, Dominic. Thank you very much for joining us today. We've just heard that there has been an increase in demand for CAMHS services. And can you tell us a little bit about how we're planning to respond to this increase in demand?
The increase in demand you've referenced is a trend that we've seen in CAMHS services long before COVID, actually, and it's a trend that has been exacerbated during the pandemic. But I think that when we look back a couple of years, the rise has been really great across all of our pathways and services in Oxleas. Some of the factors that there's not one sole factor that's contributed to this from our own experience, but I think the key areas such as school and social media, pressures at home, continue to be really difficult factors and issues for children and young people, which we see having an impact on their mental health.
So I think more recently we have seen a rise in crisis referrals to CAMHS. I think the presentations that young people have been coming in for have changed slightly. So we have a number of young people who have become quite unwell during the course of the COVID pandemic, particularly when schools are shut and their contact with other young people and services is reduced. So we are seeing lots of young people who have more eating problems, sort of similar to eating disorders, but also on a kind of neglect side. Young people who are struggling to get out of their bedrooms, who are quite depressed, and also a large number of young people who are feeling quite anxious in relation to COVID and sometimes in relation to returning to school as well.
You've mentioned an increase in demand, and I'm just wondering whether the increase in demand is to do with more people needing support and services, or whether it's to do with a better awareness of services that are available to people.
I think it's absolutely right to raise that, Teresa, and there's been a huge amount of work across both adult and child services to increase awareness of the available services locally, but also to reduce stigma. And in Oxleas, we've been working really hard to engage with our communities, and there's lots of work that we've been doing to ensure that referral pathways are really clear, and that might include working with schools or with GPs, and they're often our two highest referring partners.
Yeah, I think particularly at the moment in the pandemic that there is young people are a bit more isolated, so they are not in contact with their peers in the way that they would be normally at school. They're not seeing family and friends so often. And I think the increase in more recently correlating with COVID is a different type of demand than we've seen before in the past, and it's completely understandable in the context of the pandemic.
So how are we planning to respond to this increase in demand?
So there's been a huge amount of investment in CAMHS services nationally, but also locally in Oxleas over the last few years, really stemming from the Future in Mind paper, which was published a number of years ago. That's been really beneficial to our teams, and we've been able to develop our services in different areas, both in terms of early intervention and prevention. So that's teams such as our mental health in schools teams, which are new initiatives where we have practitioners and clinicians working in school settings. But also at the other end of our pathways, where we have new specialist clinical pathways, such as our dialectical behavioural therapy service. So there has been significant investment, but we expect there to be further investment which will meet this increase in demand we've seen. And there's a real commitment to further investment in child mental health services as outlined in the long-term plan?
I think, Teresa, we've really had to be creative with our resources at the moment, and staff have really supported that. We are maintaining a virtual session offer to young people and have done throughout the pandemic. And we've also been able to have a face-to-face contact in the clinic for the priority cases, so particularly those for high risk and those young people that might be at risk of disengaging. And I think, it's a real challenge to do this in the middle of a pandemic when staff are working from home, but there is still a keen eye on maintaining quality and standards of care, and having sort of overview that we are getting throughput within the service too.
And can I ask how you're looking after the mental health of your staff, obviously, in these times as well, because they've got a service that they need to provide, but it's just as tough for them as it is for the children as well.
We're really aware of how difficult it is for staff working remotely at this time, often dealing with really complex clinical cases and having to make decisions in their own homes. I think what we've learned since March is the importance of connection with staff at all times, and we really reinforce that message with our senior managers and clinical leads, that there's a need to make sure that we're connecting as teams now more so than ever. I mean, I think that extends not just to kind of clinical case discussions, but also having team meetings and making sure we have reflective spaces for the teams to come together. We were fortunate to be able to be a bit more present in the clinic base over the summer, where there was a slight relaxation of rules. Unfortunately, we're not there now, but we do recognise how important that is also for maintaining staff wellbeing. I think also there's a huge amount of work that's happening in the trust about focusing on staff wellbeing, especially in these last 2 months. And I think we're really encouraging staff in CAMHS to engage with that as much as possible.
No, I think that's really right, Dom. I think at the ground level and for the clinical cases, the increased case discussions in the reflective spaces have been really, really important to staff, acknowledging that these young people are quite unwell and that we need to allow ourselves space to process the issues, both as a team and clinically as well.
That's lovely. Thank you both for joining us today. Much appreciated.
Thank you there to our colleagues in Child and Adolescent Mental Health Services. Great to hear from them about the way they've been working and the challenges that this past year has brought them. So our last item today, I just wanted to give you a quick update on the work that we've been doing around building a fairer Oxleas. So this is the work we're doing to try to make sure that we respect everyone across the trust, given their differences of experience, their different ethnic backgrounds, all those things that bring us together as a team, but all those things that I think in the past year it's been highlighted to us how important it is that we make time to learn about each other's differences and how that affects our experiences of life and work. And there's a couple of things you can do. You can have a look at the Building a Fairer Oxleas pages on the Ox. There's a lot more information on there now. There's now a regular newsletter you can look at that's got information on what we've been doing around that. We're doing some really quite detailed work on recruitment, because we've identified that recruitment and fairness of opportunity has become a really big thing for the NHS and for Oxleas to get right. And it's really important that we demonstrate through our processes and the way that we create opportunities within the trust that we're doing so fairly and in a way that's accessible to everybody. So do make sure that you have a look at the work we're doing in terms of the ways we're changing our recruitment processes. That's whether you're a member of staff looking for a new role or whether you're a recruiting manager going to be part of a panel, because we're making some real improvements to the way we manage those processes. We're starting a pulse survey as well of our BAME staff to make sure that we're listening to people's experiences and reflecting on whether the changes we're making are having an impact. And we've taken feedback about how often we should do that as well, because I think there has been a sense at times in the past year that people have felt a little bit surveyed out. We saw that in our staff survey results, more of which shortly on Oxwide. I think the sense that people feel as though there's being asked an appropriate amount and sometimes being asked a little bit too much. So we've listened, so we'll make sure that we're doing that regularly, but not too often that it loses impact. And the last thing we're doing is putting together a suite of films about microaggressions. Now, part of the experience for me of everything we've encountered in the last year around Black Lives Matter and talking to our lived experience staff, people who've been living with mental illness and experiences of poor mental health, talking to our LGBT network, is how we need to understand what it's like experiencing life as someone who isn't like me, a white man who travels through life without experiencing any kind of discrimination from anyone. I don't understand what that experience is like. So it's important that we're all receptive and open to each other and learn to listen about how our interactions with each other can have an impact on one another. And we need to do that in a sensible way, where I don't want us to get to the position where we feel as though we just can't talk to each other for fear of causing offence or treading on each other's toes. But equally, we need to be ready to listen and to learn and to change our practice or change the way we speak if we realise and understand that it's causing harm or upset to others. So microaggressions are the small things, the small verbal things or behavioural things that people from different ethnic backgrounds or other kinds of diverse backgrounds experience in their day-to-day experience of life and work. And there's some really good literature on microaggressions that stems from a research base, but on the longer term impacts it can have on people. And it can be relatively small things or comments that you say that I might not even realise that I'm saying something that someone else might find upsetting. But as with all of this, it's important that we're open and receptive and ready to learn. So do look out for some of those short films on microaggressions we're doing. One of the things I've heard from a lot of you when we've been talking about building a Fairer Oxleas and Black Lives Matters is that some of us, we feel worried about having conversations about things like race or gender or sexual identity or about experience of lived experience in mental health. So this is part of our efforts as a trust to help educate each other and understand more about each other's experiences and where we're coming from. So as I said, look on the Ox, look at building the Fairer Oxleas and the supporting material there, and look out for those films on microaggressions as soon as we publish them. So that's all for this week. A good canter around a couple of different subjects and topics there. Thanks to colleagues from IT and from CAMHS for their input today. And I hope you all get a decent break as and when you can. Hopefully by the time you watch this, some of the snow will have receded. And as I said at the start, if you haven't had your vaccine yet, please do get it. It absolutely makes sense for your own sake, for the sake of your family, and for the sake of the patients you're caring for. Thanks, everyone. Until next time, see you soon.